Hello, everyone. Good afternoon. I am Tanisha Stewart. I come to you today from Banyan Health Systems, and I would like to present to you our company and what we do to support our community. So Banyan is quite dedicated to a diverse community in South Florida, and we currently serve clients as far as Miami into Broward County. At the end of this presentation, I will also, even though the slide is there with our contact number and email, I will again give you the information for us to reach out to you or for you to reach out to us, to myself, Tanisha Stewart, or Caitlin Laguerre. So a little bit of a history about Banyan. So we've been around since 1970. We've been helping our community where we primarily did behavioral health and substance use. We have today in our company 13 sites where we serve over 17,000 patients each year. We do so by providing both behavioral care and primary health care to our community. We provide this healthcare, integrated healthcare to both insured, uninsured, and underinsured, to clients and families with limited access to care. So as you can see from this slide, we do a full integrated care where we provide primary care, mental health, substance use, research, and evaluation. So on this slide, we get to see how many clients we serve per month. We serve 1,500 clients each month. The company has 360 employees, 13 locations, which span from Miami to Broward County. We have 3 primary care sites with integrated behavioral health services, 4 substance use and behavioral health residential facilities, 1 comprehensive behavioral health outpatient practice, 1 adult central receiving facility for crisis stabilization, 1 drop-in activity center, 1 pharmacy, HUD housing, and a mobile health crisis unit. Banyan locations, 3 of which are award-winning health centers, and these centers are designated as federally qualified health centers, FQHCs. The FQHCs provide health services to our population for medically underserved in our community, regardless of their ability to pay. So some of the social determinants that we've looked at that affect our clients is housing insecurity, lack of employment, mental health and substance abuse stigma in their family and within the community, other underlying health issues, lack of cultural competent mental health care providers to treat a diverse community such as ours, lack of care for people with multiple physical comorbidities and mental health, lack of community support, language barriers, geography, lack of transportation, fear of civil immigration status interfering with access to care, food insecurity, educational gaps, and lack of finances to afford health care. So these social determinants, over the 50 years, Banyan has been committed to eliminating these barriers to care for our most vulnerable population. By identifying these social determinants through research and integration, we have been able to address these inequalities and improve clinical outcomes and quality of life. So some of our services, as mentioned before, include behavioral health, psychiatric services for both adult and children, therapy, counseling, peer support, substance abuse treatment, primary care, including women's health services, which we started in 2018, pediatrics and adolescent care, laboratory services, pharmacy, residential treatment, crisis response team, crisis stabilization and detox unit, and health inequalities research. So a little bit of a history. So Banyan Health System is a merge between Spectrum Program, which was founded in Broward County in 1970, and Miami Behavioral Health Center, which was founded in Miami-Dade County. So in 2003, both companies merged to create Banyan Health Systems. Banyan in 2019 incorporated their primary care facility. 2009. And then in 2018, created our women's health services. Today, we now have a Banyan Health, which is a new primary care service, which is in Cutler Bay in Miami-Dade, Florida. As I come to you from Broward County, so this is our location here in Broward County, and we are located at 1061 West Oakland Park Boulevard. And later on in the presentation, I will go through step-by-step process for clients who visit this outpatient facility and the services that are offered to them. So at this site, we have master level licensed clinician, case managers, peer support specialists. We even have peer and advocates who are here along with psychiatrists to provide compassionate health to both adults and children of our community here in Broward. So our services in Broward, as mentioned, incorporates both adult and children. We are involved with child welfare clients through our family engagement program, through referrals from Broward Sheriff's Child Protective Services, and even self-referrals. We also have a level 2 residential treatment for clients within the community. We also have that for clients who are incarcerated and looking to reintegrate within the community through treatment. So a little bit more in depth of the services that we offer in reference to our federally qualified health centers. So we do offer free transportation to our community health centers. And that means free transportation as it is currently for clients who reside in Miami-Dade County. We will be working on having a federally qualified health center here in Broward very soon. Nevertheless, should a client come to our Broward facility and wish to be seen through our primary care facility, once they get to Miami and they start to see our doctors there, whatever prescription they have, we will deliver that prescription to their front door, and we go as far as Port St. Lucie. So a little bit about our primary care services, which is currently in Miami-Dade County. We have women's health, including prenatal care, delivery with specialized focus on behavioral health patients, pediatrics, men's health, including colorectal screenings, senior care, diabetes screenings and management, hypertension management, asthma screening and treatment. So currently, some statistics. We have people who die from substance use overdose more than those who die from a combination of gun and vehicle crashes. So 21 million Americans report having some sort of substance abuse disorder. About 10% of them are receiving treatment. So that's a significantly low percentage. Of those 21 million people, 40% of them have underlying mental health conditions. But only 20% of them are receiving any kind of help for either issue, let alone both. Nearly half of the people with mental health have more than one diagnosis. So with that said, we see that the need for mental health care starts at a very young age. Over 17 million kids in the US have a psychiatric disorder, and 1 in 5 child shows symptom of mental health disorder. The average age for persons showing symptoms of mental health illness is 14. So with those statistics, Banyan also offers mobile crisis response, which is 24 hours per day. And as you can see, our contact is there as well. We offer bilingual representatives who are ready to support our community. An overview of our pediatric services. We provide compassionate intake, observation, diagnostic assessment, functional assessments, interviews, family interviews, treatment planning, primary care referral if needed, mental health, primary care service delivery, and continued assessment and evaluation for services. So let's talk a little bit about what happens during an evaluation. So once a client comes in for an evaluation, they are assessed by a licensed professional for suicide and risk of violence. During this time, we also obtain authorization and consent forms from individuals. Say, for instance, you want us to speak to a family member, the court system, child welfare system. We can obtain that consent because we do not provide information without your permission, of course. Interviews and questions. So within the evaluation, there's a host of questions that typically are asked of clients that will comprise of current symptoms, history of the illness, medical history, family history, social history, and any history or current substance use or abuse problem. So here in Broward, we serve, of our clients, we have 280 of our clients who are child welfare involved, 40 of which are misdemeanor felony cases. So for what it's worth, somebody would say, well, 280 is not a lot. Yes, it's a lot. But that's what we're here for. We're here to ensure that our clients are provided services so that they get the tools to ensure that children are safe, and they themselves as parents can ensure that. We're going to go through a little bit of a case study of, as mentioned before, what happens when a client comes in, and we'll focus today on child welfare involved clients. So we may get a referral from the Family Engagement Program, which is through Henderson Behavioral Health. We may also get a referral from Broward Sheriff's Child Protective Services for services. And this service can be for mental health evaluation or substance use evaluation. So once we receive that referral, we will respond within 24 hours to the referral, at which point we will then reach out to the client who is being referred to us to schedule an appointment for an evaluation. Once the client is called, well, now we also have telehealth services, so that's great for our clients as well. So the client now has the option to attend these appointments in person or via telehealth. The client is contacted at the date of the appointment, or they're in office at the date of the appointment, at which point they will provide demographic information, consents, and if it's a referral for substance use, they will submit to a drug test, which is typically observed. And we make sure that during the observation process, it's comfortable. So we ensure that females are linked with females and males with males. So once the intake process has been completed, the client then sits with or sees the licensed clinician, at which point we'll ask a host of those questions: family history, substance use history, current symptoms of mental health, just to determine not only the needs of the client, but also the strengths. So let's say, for instance, at the end of the evaluation, the clinician decides that because of the needs, this client needs case management, and also because of the symptoms or the diagnosis, they will require psychiatric services and also primary care. So the client will be referred to a primary care facility, which is in Miami-Dade, should they wish to go. If they do not wish to go, we will try to refer them to another facility that is closest to them. During that time, they will also get an appointment to see our psychiatrist where needed. So let's say our client comes in and say, yes, I'm very much interested in going to your primary care facility because I want to keep all my services with one company. It's easier for me. We're fine. We will make the transition happen smoothly. So they will go to the medical center in our Miami location where they're provided a full physical. And if for whatever reason, prescriptions are provided by the doctor, at that point, the client will not have to worry. The prescription can be delivered directly to the client from our pharmacy, which is located in Miami. So because we're focusing on Broward clients here, it doesn't matter if the person lives in Broward. The prescription will be sent to the Broward location where it's delivered directly to the person. So after the evaluation, the client is then contacted by a therapist, at which point we'll call, introduce themselves to begin weekly or bi-weekly sessions where we're needed. And during this time, if it's a substance use client, the client is expected to submit to random drug tests. And the drug tests are not meant to be evasive. The drug test is actually a tool that we use, not just for reporting purposes to child welfare or any other interested agency, but to help the client. So we use it as a motivation. So a client may come in and their drug test results indicate high levels of something. And then as they begin treatment and they do their drug test, they see that, it's coming out of their system, they're getting better, their cravings are going down. So we also use that as a positive tool. The client can remain in treatment for up to 6 months. Where indicated for some situations, it can be for longer, but it rarely happens. So during this time, the client completes a treatment plan, and after successful completion, they're required to do a return, to do follow-up care to make sure everything is going okay. If they continue to go to our primary care, that's fine as well. It doesn't mean if you are discharged from behavioral health, you will never get to continue primary care. It's integration. And we understand that some services might end before others, and that's completely fine. So we encourage that. So during this time, a client, and it's not mentioned on this slide, but it's worth telling in this presentation that the client is not provided a therapist or a case manager. We have other auxiliary services like peer support specialists, and those individuals are persons coming from a lived experience, and they provide great value to the treatment team. And we also have peer and advocate services, which is quite important for child welfare involved clients, because our peer and advocates assist our clients, the parents specifically, to improve upon their parenting skills, to help with budgeting and making calls and referrals, anything to do with childcare. And not only that, to improve themselves as individuals, help with completing resumes, anything that is needed by the client. So overall, Banyan's mission is to find ways to provide innovative ways to deliver care to our communities despite the barriers such as transportation, financial concerns, immigration status, geography, and more. So not many persons in our community are really aware of what we do here. We're just seen as a substance use mental health facility, and we're far more than that. We will like to treat our entire community as a whole, and that means health body-wise and health mind-wise. We also treat the family together as a unit. Should you have any questions about this presentation, or even would like to provide us a referral, you can provide self-referrals as well. You can always call us at 954-327-4060, or you may email me, Tanisha Stewart, at tstewart@banyanhealth.org, or practice manager, Caitlin Laguerre, claguerre@banyanhealth.org, where we are willing, able to answer any questions and provide you some direction as to receiving services. Thank you.